Good afternoon, everyone, and welcome back to the Ethics and Society stage at the 2021 CogX Hybrid Festival. My name is Andrew Strait. I am the Associate Director of Research Partnerships at the Ada Lovelace Institute and your MC for the next few sessions. I'm very excited to introduce this next panel. This is a panel discussion that will focus on closing the data divide, COVID-19 and beyond, which will look at some of the various COVID-related health technologies that have arisen and what the conditions are needed to be able to use them responsibly and equitably. I'm very excited to introduce the moderator for this panel, Rima Patel, the Associate Director of Impact at the Ada Lovelace Institute. Rima, I'll hand it to you, and thanks so much for joining. We'll see you very shortly.
Hi, everyone. Thank you for your patience while we have endured some technical hiccups. So the data divide is about the gap between those who feel they have agency and control over data-driven technologies and those who do not. And we've written a report about this, articulating what that looks like. We have two excellent panelists who will introduce themselves. One is Dr. Nicola Byrne, who's from the National Data Guardian's Office, and the other is Professor Anne Phoenix, who's from the ONS, the Office for National Statistics Task Force on Inclusive Data. So I'll ask them to briefly introduce themselves and then to address the question, why does the data divide matter? How can we help address health and social inequalities when it comes to users of data-driven technology? So over to you, Nicola, and then we'll move to Anne to explore this in a bit more detail.
Thank you, Rima. I'm delighted to be here. So thank you very much for the invitation. So my name's Nicola Byrne. I am the National Data Guardian for England. And prior to coming into this role in April, I have a background as being a clinician. I'm a psychiatrist in adult mental health care. And I've also got a background as a Chief Clinical Information Officer and a Court Guardian in my NHS Trust, where I'm still working part-time clinically. And I suppose to come to Rina's question, or perhaps before I should mention a little bit about the National Data Guardian role for those of you that don't know. But essentially, it's a role in which I have a statutory power to issue guidance to the health and social care system in England about the use of confidential health and care information. And alongside that, a role in advising and guiding the system about its use. So to answer the question about why does addressing the data divide matter, I suppose I might break that into sort of two main parts, that answer. And I suppose the first of that would be that in addressing the data divide, it's inextricably linked to the digital divide, obviously. And that in itself, I think, is again inextricably linked to the social divide and the current health and care inequalities that are so evident, not only nationally, but obviously internationally. So in addressing the data divide, you have to be thinking about how we're looking at very fundamental questions about unequal access to healthcare, unequal experience of healthcare, and also unequal outcomes in our health and care systems. So the first part of that answer, I think, has to be that addressing the data divide is the morally right thing to do. It's something we simply have to address. And the second part of the answer, I think, is a more practical one, in that if we don't, then things aren't going to work. We have to look at data and the quality of our data sets and how representative they are, etc. I suppose at the level of developing products, digital products, data products, AI products, if there is a data divide in terms of the representative nature of data sets that tools are built on, obviously the limitations of those tools would be significant and sometimes hidden and only become apparent later on during use. And I suspect with this audience there'll be many listening who are far more familiar with the details of cases where that's been the case in terms of training data sets for different AI systems that have proved to be problematic and quite rightly challenged in potential inequalities they might perpetuate unknowingly, unwittingly, I should say. So it's not only the design of products, but I think also important in terms of things working in the design of our systems. There's been a mantra for a few years in the UK, certainly in the NHS, that we have a digital first NHS, a digital system first. And I suppose there's a question, well, what does that mean, and how can that become a reality if we have significant inequalities in people's digital access, digital confidence? We know, for example, that I think around 20% of the UK population don't have access, either the access or means or the digital capability to engage with digital data online, and to access their health online, whether that's through problems with digital literacy and or data poverty, as it's being termed, in terms of their access to the internet. So thinking about that system level digital first, I suppose there's an issue about whether or not our systems address the needs of everyone in the communities they're supposed to serve. If we want people to engage with the systems, we've got to think about what their motivation for doing so might be, and whether certain communities might be less motivated to engage with digital systems for whatever reason. And I suppose that nicely ties into the idea of population buy-in to digital and data systems. And we've had a very interesting recent example in the UK of this being quite a hot topic, I guess, as many listening will be aware. In recent weeks, a new system for collection from GP data systems was announced by NHS Digital. And this is to replace an existing system. But for whatever reason, and clearly it's a complex issue, there has been a sense that it hasn't landed well, and there have been lots of concerns on social media and in the media about the nature and purpose of this system, and essentially whether people can trust it. And as a result of that, I understand a significant number of people, there's been a slight upsurge in the number of people that are opting out of having their data being used, and opting out of their data flowing to NHS Digital. Now, that is a question of very much a question of buy-in to the purpose and use. So that's not about a data divide that's about digital illiteracy, for example. Quite the opposite. The people that are choosing to opt out, as I understand it, many of it's because they have concerns about whether they trust the system, which is a very different question. I think it's worth touching on briefly, if I have the time, Rima, and do come in if I should wrap up now at this point. But COVID is obviously, during the pandemic, we've obviously seen very differential levels of access to remote healthcare. Many people have happily, delightedly moved their healthcare online, whether that's interacting with primary care, using apps, trackers, etc. But for many people, that's not proved a possibility. And there is some evidence already collated by organisations such as National Voices, which is a UK organisation of health and care charities, looking at the difficulties those who are often multiply disadvantaged in the communities, the difficulties they've had with this sort of rapid shift to online access and digital and data products online. But the second question, I suppose, COVID's already brought home to me from personal experience. It's not, the issues with engaging with a digital first system aren't just simply about within the individual. My personal experience has been a one family member with primary care and their healthcare coming through a system that was wonderfully easy to navigate. And I, on their behalf, was interacting with their GP that they had remote appointments with, they had phone calls with, I had email exchanges with the GP, and appointment it was necessary, the GP went round and did a home visit. It was a perfect system. It was a blend of the old school, in person when needed, and remote when not. But my own personal experience of trying to access primary care has been quite problematic, and I've found the systems very difficult to navigate. So closing the data and digital divide really does need to look at also how systems are built around people, and whether, if you like, missing data is only just about the data that's missing, but in the actual design of systems, is there data missing about user experience and what the needs of the users are going to be? And I think often there can be. I think at that point, Rima, perhaps I should stop there, because we get onto positive uses of data during the pandemic later, if you like, rather than me talk too long at this point. Would that be better?
No, I think that would be perfect. And thank you very much for your reflections on a range of initiatives that have been deployed during the pandemic. I would like to ask Professor Anne Phoenix to introduce herself, and in particular to pick up on this question that relates to the last point that you raised, which is about missing data and the kind of issues that come up when it comes to missing data, and what kinds of data might be missing, in addition to, I guess, positing data as objective and neutral. So, Anne, would you be able to introduce yourself and speak to that question and more? Thank you.
Yes. Thank you very much, Rima. And my name is Anne Phoenix. I'm Professor of Psychosocial Studies at the Thomas Coram Research Unit, which is part of the Social Research Institute at UCL. And I am also on the Inclusive Data Task Force, which has been set up by ONS. It's not yet reported, so there's nothing I have to report from there, but I will mention it again in a moment. And I think what Nicola had to say really helped what I have to say. So I won't repeat some of the things that she said, but simply to highlight what she said about the data divide being linked to the digital divide and to the social divide. And the pandemic has made absolutely clear that all those divides matter for outcomes in so many ways. And I want to argue that those divides are also intersectionally patterned. What I mean by that is that ethnicity, gender, age, region, bodiedness, socioeconomic resources, they all come together, and they do so to reproduce already existing patterns of inequalities. So if we're thinking about the sorts of data that are missing, as Rima just asked, and why they matter, well, one of the reasons is that people who are digitally poor, who are also poor in terms of access to using data, are also further excluded from inclusion in normative patterns, in what is seen as normal. Their concerns and their everyday practices are not recorded when one's focusing on recording things through the digital, for example. They're much more invisible to those producing algorithms, and this in itself contributes to their exclusion from the normative. Raises the question of how we can get data that is not exclusionary. But that exclusion from the normative is not new. Various researchers have pointed out over the last few years that there are implicit assumptions that have frequently excluded, for example, women and minoritized ethnic groups from digital inclusion, and sometimes with dire consequences, as, for example, Caroline Criado Perez points out about women's health and the symptoms, the diseases that are not given so much attention when the normative is assumed to be a white man. And lots of people, Safia Noble, Lauren Pasquale and others, have been writing about the ways in which Black people, those from other minoritized ethnic groups, are also often left out when it comes to thinking about healthcare or employability and so on. So that we need to think about the way in which data-driven applications can reproduce gendered and racialized inequalities, and yet at the same time masquerade as objective. And Ruha Benjamin, in her latest book, talks about the way that there are a range of discriminatory designs that are encoded encode inequity, and at the same time they ignore and replicate social inequities by treating everything as if it's normal, as if what they're doing by avoiding, by ignoring the data that does not exist is simply natural and normal. And what it does is to reproduce an abnormality, a non-normativity of certain groups. Many people, for example, were really shocked to hear in 2019 that Black women are 4 to 5 times more likely to die in childbirth than white women, and that Asian women are 2 times more likely to die. And what that means is that all this time there have been these disparities, and many people didn't know. Certainly women themselves often did not know. And it's astonishing that that disparity could exist and that it's not been attended to previously. Nicola mentioned the whole issue about NHS digital and the difficulties that have arisen because many people have campaigned for others not to opt in to the system, but instead to opt out. And really, that is, as Nicola said, an issue of trust. The point is that the data divide can amplify social inequities by failing to include people who are already socially excluded. And in doing that, in producing normative understandings that exclude them and reproducing those normative understandings, it means that they are left out to start with, and that their informed consent is really not the same as other people's informed consent because, for example, they don't have access to computers, to the digital in the same way. So we know that the recording of data and the ability to analyze and publish analyses quickly is crucial. It's really important. But at the same time, we need to understand that for some people who are not included into the normative in the first place and who don't have the same possibilities for excluding themselves, need to be given access within society if there is to be equity, but also if we're to have a society that genuinely does what President Biden is saying is build back better world. 3 Bs, B3 and W. We cannot do that unless people are convinced that government, the health service, local authorities and so on are on their side, will not endanger them, and so that therefore they're happy to give their data, but also that they have access to the data. So I would say that one needs to be able to trust, but not only that, and Nicola mentioned that already, we need trustworthiness of the system. We need people to know that when they hand their data over, not only will it be used in ways that they would approve of, but that if there are issues, if there are inequalities that are found in the data, something will be done. There is no point, for example, knowing that so many school children are in food poverty if all we're doing is collecting the data and not addressing it. Those sorts of issues are also at the heart of debates around things like the vaccine passports, where there are many MPs even who are opposing vaccine passports because they point out that what it's doing is being discriminatory, or what it would do is be discriminatory and divisive against people who already experience discrimination and who are already excluded. It's creating potentially a 2-tier system that reproduces intersectional inequalities in an unhelpful way, as well as worries about infringing on medical confidentiality, and also concerns that government may not be in their interests. Having said all that, I want to mention just a few positives, because of course, the flip side of these negatives is that we know that having data is really helpful, and many people are working to improve equity. And I want to mention, for example, the fact that IBM and Microsoft in 2020 really told us that they would not be using facial recognition or facial recognition analysis software in ways that are indiscriminate and ways that reproduce systemic racism. Because if these inequalities are intersectional, we have to think about racism. We have to think about sexism in thinking about the linking of the social and data. It's also very hopeful that so many people are now publishing on these digital inequalities and the ways in which these are racialized and gendered, and that there are groups addressing it, like, for example, Black Girls Code. I also think it's helpful that the collecting of data has allowed us, for example, to see what's going on in schools. Now, I know that I need to wrap up, so I will do that. Just to mention that I'm also very pleased with the ONS Inclusive Data Task Force, because it's one way in which the government, in which the ONS is really treating these issues seriously.
Thank you. And just we're really looking forward to hearing its findings and its recommendations when that comes out. Just to move into a bit of a Q&A and discussion about some of the issues that yourself and Nicola have raised. There's just something really interesting about this question around trustworthiness, Anne, that you've raised, and in particular what we're calling at the Ada Lovelace Institute responsible data stewardship. And so I'd like to turn to Nicola and ask her, building on that, what do you think, and certainly building on the legacy of Dame Fiona Caldicott, what do you think the norms, cultures of responsible data stewardship should be, and how should people who are building data systems, designers, developers, perhaps even NHS Digital, although I won't ask you to speak specifically to that, but what are those norms and cultures that that technologists should embed when it comes to the use of sensitive data?
I think a key point I would stress is that it's not enough to develop a system that you think is safe and effective. You've got, I think a key point is you need to demonstrate your competence. For people to trust you, I think they need to understand and have a sense of what your values are, what it is you're trying to do, the purpose of what you're doing. But be clear that you can demonstrate that you're competent. And by that, I mean, I suppose several things come under that. Can people know about the systems you have, for example, for governance, or how decisions are made about data, or how, in at least basic sense, data is going to be kept secure? And I also think people want some kind of mature and authentic engagement with questions around risk. So it's not, I think if you tell people there's nothing to see here, don't worry, there's no such thing, if you imply that any system, digital or otherwise, in healthcare is risk-free, I think that's disingenuous and unhelpful, and it makes people sort of suspicious, innately suspicious. I think you have to really authentically engage with what people's concerns around risk may be. And I also think it's helpful that you make it clear where your system, whatever it is you're doing, how it fits into the bigger picture. What's the role of a particular app or software system? How does it relate to the bigger picture in my care, for example, or at a system level? How does it fit into the system of health and care in my local area? And I think the final point I think it's important to make, that people need to see that yours is a learning system. So again, I think that comes back to being honest about risk. It's not to say that any system is ever going to be perfect, because it never will. But you need to be demonstrating that you are going to continually iterate and learn. People need to feel confident about that. So I think those are sort of some key thoughts I'd have about what makes the system both be, but also look and feel trustworthy in a way that will get people to buy into it.
Thank you. It does certainly feel, from what you're saying, Nicola, that what's really important is evidence of trustworthiness and perception of trustworthiness, as much as the nuts and the bolts of a technical system itself. And Anne, I just wanted to turn to you and ask you to expand a bit more on some of the points that you were making about underrepresented populations, so minoritized or racialized, or diverse gendered identity, people with diverse gendered identity. So what do you think the types of approaches should be for technologists in ensuring that they're working with a range of different perspectives, understanding and taking account of those intersectional identities that you mentioned?
And I'd like to start answering that by perhaps going back into the past and bridging with the answer that I think Nicola gave so elegantly just now, by looking back to really a pre-common digital age, when in the 1981 census, the Office of Population Censuses and Surveys wanted to collect ethnic data, the ethnic question, on the census. And Black groups in particular, but not only Black groups, absolutely opposed this. And they opposed it on the grounds that they saw it as tied up with immigration and potentially expelling people from the country, control, and of no benefits. In the end, it had to be dropped, and it came back in 1991, and the reason I'm giving this example is because it shows dynamism and the potential for change. It could come back because Black populations then became convinced that actually they needed the information themselves about differentials if they were really to show the extent of racism and racialized discrimination in the country, and to make an argument for improvement. So what does that say? It says something about it being really important to take people with you, that actually has to be in their interest, and they have to see that it's in their interest, but also that trust has to be built up not just on one particular data set, not just on collecting information about something now, but actually around it. That, you know, we want to know, for example, that Microsoft and IBM, not just when they want to collect particular forms of data, NHS Digital, not just when it wants to collect particular data or to scrape our data and pass it on, but we need to know that for everybody and for different groups, gendered, racialized groups, and those intersections, that no harm is going to be done, but not only that, there is intention to do good. And I think that that is often what falls short, because the more that people learn, for example, about what's not done, for example, in the health service, as I gave the example about Black women and maternity and so on, the more they distrust that their interests are being taken to heart in the digital.
Thank you so much. So I just want to move to one last question for both of you, and this relates to really your key message. There's a really broad audience here, but in particular, a lot of people thinking about the implementation, the design and the development of technology. And Nicola, this one's for you first, and then Anne. What one key message would you want to draw from all of your experience and leave with developers and thinkers about technology, and just summarize what that might be?
I'm going to cheat slightly and divide it into two, Rima, if that's okay. But because my first part of it, I think, would be addressed more to designers and developers of products, if you like, and it would be to just be systematically addressing your representation risk, if we want to call it that. Who might not be represented in the data and your thinking in terms of the systems you're building? When you're building them, are you meeting the right people? Are you asking the right questions and actually finding out what people's needs are? And there's actually a good, for people that aren't familiar with it, it's a few years old now, 2019, pre-COVID, ancient history, but there's an NHS digital guide, I think it's called Digital Inclusion for Health and Social Care, that I think is very good, very helpful, and has some very simple basic principles around design that include do the hard work of making things simple. It's my favorite one. The second part of that take-home message would be more to people working within systems, thinking strategically about how things fit together, and I think would be to firmly locate the problem of the data divide within the digital divide, and that being located, just as Anne's been saying, in these sort of intersectional, the difficulties of people that have who are multiply disadvantaged. And if you locate the problem there, then I think you'll find your solutions often aren't some separate digital data solution right over there. They may be embedded in the reality of what's happening in local communities to address multiple different problems. So an individual might be going to the same place to access a food bank, welfare benefit support, job support at the same time, and within that context, getting some help around digital skills and the ability to get on board and become sort of more data involved, if you like, using apps or what have you. So that's where the solutions may be sort of integrated with alongside others.
Thank you. And could I turn to Anne and ask you as well, what would be your key message, or indeed key messages? Feel free to, as Nicola has done, just adapt the question.
Thank you. And I would endorse what Nicola has said. And in her finishing off about the augmenting skills, to remind us that we also need to make sure that access is available in terms of computers and so on. What some people are saying is that the children who, during periods of lockdown, eventually were given computers are now in some schools having the schools take those back because they were seen as loans. Well, that puts the children back in a situation where they can't investigate things online the way that other children can. So I think just to add to that, but agree with everything Nicola said, the messages I'd want to give is first that data are not neutral. Everybody knows that. And of course, you know, I'm preaching to the converted, but they're not neutral, they're not innocent. And what it means is that building consensus means that we need to be able to show people that, for example, the algorithms that are being used, the data that's being shared is being done in a context of overt commitment to intersectional equality in society, and that the data are part of that in everyday life, in institutions generally, with a recognition that the mantra that many people are talking about, we're to do with vaccines, we're not safe until all are safe, is equally, we're not able to function holistically and to move forward with good data understandings and commitment to produce these until everybody feels comfortable with this. And I don't mean every individual, I mean all the different intersecting groups that to which people belong. We really need to get that right. And I think that one of the ways in which that we could start to do it is that we shouldn't be talking about hard to reach populations. Now, some people have stopped doing that already, but actually there aren't hard to reach populations. They never have any difficulty reaching other people in their social groupings. So we need to recognize that data in itself can reproduce and produce afresh discriminations, and that those matter, and that the people who are seen as hard to reach are living in context where, because of their positioning in society, they have no choice. They're seen as not accessible, and they don't have access to some of the things that other people do. So whether implicitly or explicitly, we need to recognize that actually these things are discriminatory, and to shift our terminology, shift our ways of thinking, and really build back a better world. I couldn't agree more in terms of data, but do that through a lens of social justice.
Thank you. And just on that point about building back a better world, the key themes I've noted here relate to the demonstration of competence and trustworthiness. It's also about addressing representation risk within the system, firmly locating the data divide within the digital divide, recognizing intersectional and multiple disadvantage, access. So that's really crucial when it comes to thinking about data, but also recognizing data itself is not neutral. And that means we have to build a consensus around what it is that we need to do when it comes to using data systems. And the really important point, which is the fallacy of thinking that there's hard to reach groups, and really thinking about how it is that we engage and make sure that everyone feels brought into our data system. I want to thank you both for an exceptional panel. Thank you so much for your time. Thank you to our amazing audience, and I'm really looking forward to seeing more on Twitter as we proceed. So just wrapping up now.
I want to thank you all so much for tuning in. We are going to take a 20-minute break and come back at 3 o'clock on the dot. I'm actually gonna hand over my emceeing duties to the wonderful Alice Thwaite from Petuzia, who's gonna lead us into the next couple sessions. But you have some very exciting sessions ahead of you today on the Ethics and Society stage, including one on diversity in tech, and another on lessons we can learn from history about the future of AI. We'll then conclude the day at about 6 p.m. with a keynote from Meg Mitchell, the former Google AI ethical AI co-lead, and that will be the end of today. But I want to thank you all so much again for taking the time. Please go outside, enjoy the sun, get some tea. We'll see you all at 3 o'clock on the dot. Thanks very much.